I'm Brianna, and this is Gavin. Gavin is a 4-year-old Clydesdale quarter horse cross. He is in here for training and basic baby management and handling. I had him for about 6 weeks initially last July just for handling, accepting the saddle, and now he's back for another kind of baby boot camp, trying to get better with his feet and just overall exposure to things. He does have a history of being very nervous, very tense. You can see now he's a little unsure, got the little creasel in his eyebrow, little whites of his eyes, really looky. So we're gonna help, our goal is just to kind of help relax him, loosen up some of those areas, figure out where he holds his tension. This is gonna be his first ever massage. So I am going to go ahead, and I'm by myself today, so I'm just gonna turn him loose here in this indoor arena. That way I can look at him walking, trotting, and if he canters, just kind of see how he reacts. And just kind of take a look at his gaits and everything. Bro. Walk on. Just give him a chance to smell everything. Come on, buddy. Looks to me like he wants to roll a little bit. Let's see if I can get him to walk away from me. Smell everything. Good. He tracks up decently well at the trot. Walking from the hind end. Come on, buddy. So maybe put you on your lead. Tracks a little behind himself, but I don't know if that's nerves or just him moving out. See if we can get him. He doesn't extend as far up underneath with his hind end at the canter. Yeah, he tracks slightly behind his front feet. Super watchy and nervous. I do know he got a really choppy trot. Really wants to stomp those front feet down. And a lot of that I think is being nervous. So I'm gonna go ahead and grab him. Set you up here. Plug you in. Grab Mr. Gavin. close, and he ran into my hand. Make sure he's in camera. Good. Alrighty. I'm gonna start by just giving him an overall check, checking his vitals. He is a little warm. He's been turned out and has been running a lot this morning. So I'm just gonna go through. No discharge in his eyes. No discharge with his nose. His owner said if I go like this, he'll put his nose in it and show me his teeth. So let's see. So he's showing me his teeth. He does have pink gums. I'm going to try to check his capillary refill response. Because he's not doing it. But his gums are pink. I can't get my finger in there to check his capillary responses. I'm going to go ahead and count his breaths now. His nostrils are flaring pretty good, so I'm going to count those. So that's about 18 breaths per minute. It is on the higher side, but he is anxious. He is running around a lot. He's breathing heavy. He goes to breathe normal. He breathes heavy again as he gets anxious over something. I'm going to tighten him up just a little bit so he can't move as much. I'm going to go ahead and see if I can get a heart rate on him. Kind of using that jugular artery. On the back side of his mandible. I do have a stethoscope in the mail on its way here, which will help the heart rate a lot easier. It's about 35 beats per minute, which is good. A little on the higher side, but not as high as it could be given how reactive he is right now. So I'm going to go through now and just kind of palpate around, see which muscles are tight. Check his TMJ first off. I'll place my hands right here. I have about probably 1.5 finger spacing on this side. I'm going to see if I can get him to bend his head a little bit. See if he can, he'll lick, chew. Give him a minute. So I can't get my finger inside of his mouth to get him to move, if I can feel that TMJ joint moving. So for the time being, I'm just going to check the spacing of it. Just kind of work with what he gives me. That's a training moment for another day. So I'm going to check his range of motion. So that I can get about 1.5 fingers. He doesn't want to give me his head at all here. It's about as far as he'll let me go without resistance. And then I can actually fit about 2 fingers on this side. And there was some play and movement there when he was just chewing. I'll see if I can get him to bend. There, I get some resistance. He does have better range of motion to the left than he does to the right. Just kind of taking things slow with him. A lot going on outside today. Wind is pretty bad. So now I'm just going to go through and just kind of palpate and check to see if we have any stress points. Checking down his brachiocephalic. There's no stress knots, but he's definitely is a little, not as loose as I would like that muscle to be. It's a little tight. And whenever I palpate, I do still like to do those effleurage strokes in between. Especially on these nervous horses. I want him to be nice and relaxed as I'm palpating around. That way I can get a good read on his, if it's bothering him or not. So there, he's calming down a bit, which is nice. I'm going to palpate down. Palpate that down underside of that brachiocephalic. Not quite a fan of that. Right there, his ears came back. This is working on that right pectoral muscle. There's a little bit of a knot there, so I'm just rubbing it a little bit, seeing if I can loosen it up. A little bit of a knot here, kind of at the right, at the top of his shoulder, right on the outside of that. So I'm just going to make a little circle with my palm, just kind of rub it a little bit. But so we have a little bit of a knot there, right above the shoulder. I believe that is part of the lower part of the trapezius that comes down. No negative reaction to his longissimus. Checking down his rib cage, feeling those obliques. Checking that cinch and girth area. Hamstring feels pretty tight. Down to his gaskin. His gaskin's not as tight, but he doesn't have a lot of movement. He's got more movement at the top of his glute than towards the bottom of it. I'm going to go to the other side. this side, his brachiocephalic is actually surprisingly less tight as the other side, but right around the probably C4, C5, it gets really tight. He wants to back up. It's uncomfortable for him. So right here about that C4, C5, it's really tight. He's got a bit of a stress knot going here. I wouldn't be surprised when I check his range of motion if he's tight in that C6, where it connects down inside. Palpating the shoulder, the trapezius that runs down his wither. He's got a little bit of over muscling on this on the trapezius on the left side, it feels like. It just feels bigger. There's no stress knots, and it's not bothering him, but it just feels denser. Hi. Check down his back. No reaction to his longissimus again. Checking down his rib cage. He's shedding out like crazy. Running down, checking those obliques. A lot more movement. And his glutes on his left side. His hamstring is a lot more pliable and movable. You have less movement on this side than you do on this side. So I already plan to spend a little extra time on his hamstring and his glutes on this side, as well as both sides of his neck up front. I'm gonna go and check his range of motion now. He's pretty good about picking up his feet. It's something we worked on last time quite a bit. Still baby moments, so we'll see what he gives us. I'm gonna ask him to pick up his foot, and I'm just going to move that fetlock. Good movement in that fetlock. No resistance in the knee. And he doesn't want me to pick up his leg to bring it forward to check his shoulder. That could be a baby thing. That could be, hey, that's uncomfortable. So I will kind of leave it at that and really just work on massaging those pec muscles down there to see if that helps. And that's something we can work on in between our massages. I feel stifle. He kind of did that for me already. Feeling down that stifle. This is a new feeling for him. Felt a little bit of a weird, like, there's a little crack there, which is funny. Not funny, but there's a little bit of a crack there. And I'll ask him to pick up his hind foot. Fetlock. The movement in his fetlock. Good range of motion in his hocks. Check his stifle, just kind of feel around. He's not having any reaction to me palpating this stifle. I wonder if it's a baby, it's hard to know if it's a baby thing or if it's an ouchie thing. I definitely let her know about it. I'd do some more backing with him. See if maybe it's just a strengthening thing, but definitely putting it on her radar. Checking his fetlock. His hock. A little bit of cracking, bending that hock. There. But range of motion in the hock feels good. Range of motion in the fetlock, good. This hoof wall feels a little warm, so I'm going to keep an eye on it. Usually, in my experience, when it's getting a little warm, maybe they have an abscess coming on, but I'm going to keep an extra eye on it. No resistance in his knee, and yeah, just starts resisting right away when I go to pick up that shoulder. I think that is more of a baby, I don't know what you're wanting of me thing. So we'll go with that. So I'm going to ask him to square up a little bit. I'm going to start by just doing some nice F-flash strokes to calm him down the neck. I'm going to go through and I'm just going to knead some circles down that brachiocephalic. I'm just going to kind of, he turns his head this way to me and grab that muscle and squeeze and just kind of make small rotations with my hands. Taking my palm and doing long pressure strokes. He wants to push into me. So right at the end of that brachiocephalic, there's that little knot. So I'm going to take my knuckle and just kind of work it in a circle. Flash strokes. Working my way down to those pec muscles. I'm going to start by just putting some pressure right on the lateral side of the right pec muscle, right on the inside of the shoulder, and just do some nice circles with my fingers. He's lowering his head. He's having moments of, my friends are out there, what's out there, but he's really calmed down a lot. I'm going to do a skin roll real quick. 1, 2, 3, 4, 5, and I'm going to release. F-flash strokes. And with him being such a baby, I do have him on I'm kind of experimenting with what length I like for them to have. I want them to be able to drop their head and have a reaction without being pulled on if they need to. I'm going to go ahead and grab that whole right pec with my hand, and I'm going to just do some friction. F-flash strokes. Work my way down to his shoulder. So I'm going to work on this trapezius muscle. Right here is kind of where he's got that knot. So I'm going to take my palm. I'm going to make pressure circles. And I'm going to use my fingertips. Trying to use my whole body and not just my hands and arms for pressure. And as I'm making these circles with my fingertips, I'm slowly working my way down. I already feel that's loosened up a little bit. That little knot is still there, but that muscle is a lot looser. So I'm going to find that little knot now. It's about the size of a quarter, I'd say. I'm going to try to pinpoint it with my knuckle. Just kind of give it some friction up and down. Friction side to side. And then F-flush. Since it is on the back side of his shoulder blade and it's not on his shoulder blade, I'm going to spend a minute there with the massage gun as well, just to kind of really help that. And then he wasn't showing much signs with his longissimus, but I'm just going to go through and kind of knead my fingers down his longissimus, relax it a bit. F-flush stroke, knead with my fingers, down his back, F-flush strokes. And then I am going to try to do a tummy tuck with him. Good. Lift it up, relax. I like to do sets of 3. So that was 1. 3. I still wanted to be careful going down here, be in a position to walk away. Just because he is little, he hasn't had those a ton. And you could see he kind of was like, ooh, what's this, with his hind foot a little bit. Go through. I'm going to start by just tapping my hand because he doesn't know what I'm doing. And then I'm going to try some cupping on his butt. Here I'm at glute. F-flush strokes. I'm going to do some pounding on his hamstring. I'm going to stand off to the side and only use one hand just because I don't know how he's going to react. That hamstring is really tight. I'm hoping that he'll accept the machine gun pretty well because that will really help with this hamstring and lower glute muscle. F-flush strokes down. I'm going to just push the muscle up with my fingertips like so. So I'm going to grab the muscle and just push it up. Kind of a little bit of friction. I'm going to do some friction side to side because I'm going to grab his hamstring and do some side to side friction. I can't get much of a grasp on it for some up and down, but we're going to go side to side. F-flush strokes. Before I move to the other side. Normally I would try to get down and get a better angle, like so, but for his hind legs I'm probably going to do it up more. But I'm going to just run my hand down. shake and move that muscle up and down. Got some pretty tight muscles here. Knead this muscle, taking my knuckles and making small circles, all the way up and then moving down that muscle. Gonna give them a little bit of friction with my knuckles because things are so tight. So I'm gonna do friction with my knuckles. Still standing in a position. Working my way down. Here I'm just going to do some skin rolling. 1, 2, 3, 4, 5. I like just holding it for a 5 count. 1, 2, 3, 4, 5. I'm gonna relax everything. Same thing. I'm gonna take my knuckles. I'm just gonna move back and forth. I don't know how he'll be with his hind end. He's pretty unpredictable sometimes, which is why I'm doing it like this. That way if he kicks or if he wants to walk off or walk around, he doesn't feel so trapped. I'm gonna grab his skin and do some friction. Since I can't get a hold of that muscle with how tight it is, so I'm just grabbing some hair and shaking it loose. Massage strokes. Some more friction. Moving down. I'm going to do some pressure down. He seems to like that. Nice, relaxed. F-block strokes to end it. Here with his mane on the side, I'm going to do some mane skin lifts. So I'm going to grab his mane and lift. He's not sure about that, so I'm just squeezing, releasing, squeezing, releasing, squeezing, releasing, working my way down his mane. I'm going to lift it up, and it's side, 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 side. Press muscle right at the base of his mane. Moves real nicely. Got a lot of hair. Probably feels nice like when we take our ponytail out. Pressure, release down. try to warm up that whole muscle. And then where that point is, I'm going to take my knuckle and do some friction at the end of that brachiocephalic. Less of a backup reaction this time in that spot. F-large strokes. Do some skin rolling. 1, 2, 3, 4, 5. 5. Work my way down to his shoulder. A little bit of skin rolling. 1, 2, 3, 4, 5. Working on that trapeze. I'm just pressure massaging down, and then once I hit the bottom, F-flash stroke. It's got a really prominent shoulder blade. Kind of over muscled on that side. Big, strong boy. Now I'm gonna do 3 more belly lifts. 1. Or tummy tuck. That's 1. 2. 3. I'm gonna tighten them up a little bit so when I go to do his hind end. Start with the F-flash strokes. Just pat him, let him know I'm here. Working my patting down. And then I'm going to cup. Work my way down. Oops. Something hit the building outside. That's why with these young horses too, if I need to just do one hand, I can keep my other hand on them as a safety and push off when needed. That way I'm not completely caught off guard. We're gonna take a minute. Do some F-flash strokes on his neck. Let him have a moment. He's licking and chewing right now. I'm gonna go to keep watching his expression because he's not sure about some of this. So I'm just going to do 1 pass, F-flash stroke. And now he's just starting to be a little rude. It's not a nervous thing. So I'm just setting my boundary with him. Just letting him calm, F-flash stroke. aggression. Flicking and chewing. And all of this is so new to him, he probably didn't even know he had some of these muscles that I'm moving. Then I'm going to be super careful with this as I run my hand along both sides of his croup. Really feel that. Feel his hip bone on the top of his iliac. And the iliosacral joint. Down the base of his tail. And I have brushed his tail up before, but I'm just going to lift it up, pull it over a little bit, see what he thinks. Ask him to step over a smidgen, bring his tail this way. See what he thinks. Back here, put a little bit of pressure on his tail. He wants to lean forward. So I'm just going to hold it for a minute. 1, 2, 3, 4, 5. Massage strokes. And I'll hold it again for 5 seconds. 1, 2, 3, 4, 5, and F5. So now I'm going to spend a couple minutes using my machine gun, if he allows me to use it. So I have this 8-ball machine gun from Equine Relief. It's great. It's got 4 different settings, and you can increase the speed of it as you need to. So what I'm going to do, it's also got the infrared light in the middle. I'm going to let him smell it, see what it is, let him check it out. I'm also going to turn it on and let him feel it. He's hitting the bubbles with his nose. I had it plugged in all last night, but apparently it's not working. So I will take it home and plug it in. It might have gotten too cold last night. So what I'm going to do is I'm going to spend a little bit more time massaging this brachiocephalic where he was sore. Arm's a little tender. There, he's licking and chewing. Rub him. I'm just putting pressure down. On that TMJ. A little more friction here. I'm going to do what that machine gun would do. going to beat with medium pressure. I gotta lick and chew. Just gonna use one hand right now because he's walking around. I just want to get this spot a little looser for him. I think it'll really help. It's already loosening him up quite a bit. I can feel some give in it. And that is Gavin's massage for the day. I'm going to go ahead and see if maybe his range of motion is a little better to both directions. Good. We got a little farther going to the left than we did beforehand. A lot farther going to the right than we did beforehand too. He seems calmer. His backup was nice and soft. So I'm going to go ahead and walk him around for about 5 or 10 minutes before I put him back. He is going to go back on turnout, so he'll have a chance to move around. With it being his first massage and with how tight he was in some areas, I didn't want to overdo it. I do want to come back with my massage gun and get that right hind, especially in the sorry, drawing a blank. In that glute and hamstring area on the right hand side. I would like to spend a little more time on that in another day. So that was it. Thank you for watching.